Hi, Facebook. Happy Friday.
Yay! Hi!
We are here today I'm here to introduce you to somebody really awesome. So I want to kind of go into how I met Dr. Bev and why the dentist isn't so scary to me anymore. In case you can't tell by her amazing smile, she is just such a good energy, and she really is. And she actually was brought to me by someone that I know. So my friend, as everyone knows, I ask people to take selfies of themselves in the dental chair. For really a couple reasons, to raise awareness, but also it gives a good opportunity for the patient to kind of bring this up to the dentist and be like, hey, this happened, blah, blah, blah. So one of my friends sends me a text of the picture of in the chair with the eye protection on, and oh my gosh, this dentist knows you, she loves you, she knows all about your story. Wait, what? So I'm like, okay, cool, how can we get her involved? Like, I want to get her involved. Like, one of the main obstacles that I have is with the dentist and with patients that come to me all the time and they go, do you recommend a dentist? And for me, that's kind of hard because I'm like, well, I don't know if that office uses eye protection. I don't know if they do continuing education credits, on infection control. Like, I need to know these things about these offices and these people before I can go ahead and recommend them. So one of the things I wanted to do is getting to know the dentist a little bit better, because after I came forward, and a lot of people say to me all the time, I'm really scared of the dentist. And I say, well, the dentist is really important. And just because what happened to me doesn't mean it's going to happen to you, especially if you take the measures that we're saying to take. But I want to kind of break that stigma and say, listen, yes, what happened to me happened to me. It's really unfortunate, but dentists are actually stepping up and saying, you know what, I support your cause, I support what you do, we care about patients, we care about infection control. And that's really why I wanted you guys to meet Dr. Bev. Now, one of the big things is everybody knows I love me some good social media. And I will post this in the link because Dr. Bev is so awesome. She is always singing and dancing, and if you haven't checked out her YouTube video yet, you will by the time we're done. But she's singing and dancing, and she literally just looks like she's having the best time with her staff, and everybody's always smiling, and it's just like such a good time. Like, why wouldn't I want to know her? So Dr. Bev decided to become one of our sponsors, and woo-woo, we are so happy about that. Look, you're getting lots of hearts. So I want to kind of just give a second so she can introduce herself to you. What is your name?
Well, my name is Beverly Jaswal, and I live in West Deptford, New Jersey.
Are you from Jersey?
Actually, no. I'm from Arizona originally.
Oh, cool. How do you like? We're cold here, aren't we, compared to Arizona?
Yes. I don't know. When I moved, I always thought I was going to move back, and then
Jersey happened.
Jersey happened, and how can I move away from South Jersey? South Jersey's amazing. I love it here. Close to Philly.
Me too. My husband will never forgive me, but I made him move to Jersey.
But I just moved here too.
I love it. It's such an awesome place to actually be. I'm a little, I love it. So, what is the name of your practice here?
Okay, the name of the practice is Love Your Smile.
And how long? Oh, you have such a nice smile too.
Oh, thanks.
And how long have you been in practice?
I've been in practice since 2012.
Okay.
And on my own in this practice since last year, May 2016.
That's awesome.
Yeah.
That is awesome. What college did you go to?
University of Pennsylvania.
Okay. So, also local.
Yeah.
When you went to college, did they suggest or did you learn to use eye protection on your patient?
Absolutely.
And were they like sticklers about it? Like, were they like, you absolutely have to use eye protection?
Yes.
That is so awesome to hear. And a big shout out big shout out to them too, because I am actually finding that newer dentists are the ones that are like ready to jump on board because they learned about eye protection and infection control when they were going to college. Sometimes it's the ones that are set in their ways a lot, that they don't want to change how they've been doing things. So they don't want to add one simple step of putting eye protection on a patient. But it's really the new generation of dental students and dentists that are coming forward and being like, this is definitely something that is so important, we have to let it happen, because they don't want what?
Oh, no, I was just going to say, it's actually not just the school, but my residency program.
Really?
Yeah, I did a hospital residency program, and they were also also very big on eye protection. Now,
how did you hear about me? Were you in school?
Actually, no, that I was already out in practice when I heard about you.
Okay.
And just like any other new dentist, we're at the mercy of, as associates, we're at the mercy of the people that we work for. Mm-hmm. And it's usually the older dentists. Mm-hmm. And in this particular practice that I was working in, practice has been open, a very successful practice, been open for 30-something years. Mm-hmm. Patients usually would sit down in the chair, and the first thing they would do is they would take their glasses off. Mm-hmm. And say, okay, I'm ready to get my work done. And, as an associate, it's not like I come with my own safety glasses.
Right.
As an associate, you kind of try to you don't want to make waves at your new job. Mm-hmm. And problems that, I ran into was, how do I tell this patient who has not had any eye protection for 20-something years to go put on these goggles? But
yes.
It's just, it's extremely
patient's
awkward.
Resistance is there.
And there's also the fear, because, you're somebody, this is this young dentist, she's someone new. Mm-hmm. I don't know
what does
her.
She know?
And why is she putting safety glasses on my eyes? What are we doing? And that's often that's the first joke is, what are you going to do to me?
Right, exactly. If you only knew.
Yeah, and so I actually first heard about you when I was already in practice. It's not a story that I like to repeat, because it's, obviously we try not to bring up bad memories, but when, I'm just going to own up to it, the very first time that I heard about you, I was actually looking up eye protection and why it isn't, like, is it mandatory? Like, or why isn't it mandatory?
Right,
and
right.
I was looking for other dentist experience with regards to eye protection, because on this specific weekend, it wasn't a very good weekend for me or my assistant. We had been working together for 2 years at that time. Mm-hmm. We were at the same practice, and in this practice, nobody wears eye protection. Like I said, patients lie down and they take off their glasses and they say, "Okay, let's get to work."
Just thinking of that.
We were doing a filling on a patient, happens to be a front tooth, and like, please keep your eyes closed, because at the time that was didn't want to create waves. That was the best I could do. Please keep your eyes closed. We were working on our patient, and it wasn't anything horrible, but still, it kind of tells you how even when you're not meaning to do anything, stuff happens. So if you can try to prevent things, why wouldn't you, right?
Exactly.
So anyway, patient's lying down, and started our filling, and we were using etch, which is basically, it's one of the things that you just apply to the tooth, and then you have to rinse off right before you put in a filling. And the patient must have, so he was lying down, it must have landed on his cheek. And when we're working, I wear surgical loops, so all I really see is the tooth, and it's, my assistant, and we're very focused in the mouth. And one little drop was all it took. I remember it was right here. Well, I'm assuming that's where it started, because it went in, and he said he thought it was water, and the patient, who had his eyes closed, blinked it in. And he was like, "Oh." He's like, "That burns." Thankfully, nothing horrible happened, but that just kind of underscores why I'm like, you know what?
Totally an accident.
At that moment, I remember thinking, that weekend, because you're still kind of waiting. Like, if anything, if you have irritation, like, make sure you see your doctor, which he did. Thankfully, he was already hooked up with Will's eye because he was having other eye problems.
I love it there.
So he ended up going to his doctor, and then there's me at home going, that was so preventable, and why am I the only dentist in the world that this has ever happened to? I started looking up eye protection. Why isn't it mandatory? What else? Are there other experiences with other dentists? And you came up. And I remember thinking, wow, I was very, very lucky today. My patient was very lucky today. And, just this overwhelming sadness. I felt like I really let someone down. And thankfully, nothing happened. But something could have happened. And it's very, very scary.
Well, it is. And especially coming from the other, first of all, owning up to something like that is just huge. Like, it's just, it is. No, it is.
It's not something that we like to talk about. Nobody wants to talk about their failures.
Again,
unfortunately,
but I wouldn't consider it a failure because why? Because what you did, yes, an accident happened, but what you became proactive and you were like, okay, I need to know more about this. Why? How can I prevent this from ever happening again? And you started doing your research, and that's how you found me. And that's one of the biggest reasons why I decided to speak up, because when I was doing my research on accidents and how often they have happened, I realized, wow, this happens often and way more than it should. And it's hard
to talk about it.
You don't talk about it. Most of the cases are closed, settled, and sealed really quickly. Therefore, it's really hard to get a true number of how often this does happen. And again, someone owning up to it and being like, this happened. How can I make sure it doesn't happen again? That's a huge thing, and that's an awesome thing.
I have to tell you, I went to Home Depot so fast and bought myself
ANSI.
I'm like, with slide shields, the works. I told my patients from now on, I don't care what anybody says.
And good for you.
In that practice, I don't know if they're still using it, but I was very vocal about it, and I hope that, even though I'm no longer there, I hope that they're still using eye protection.
And I hope they are too, for their patients' safety as well. I mean, it really is. Everybody in that room, and what a lot of people don't realize is, and I learned this because, again, dentistry wasn't something I chose to get into. It was just something that fell in my eye. You got to be able to laugh, okay, or it's just not going to work. So, but literally, it was just something that I had to learn, and so with following everybody on Instagram and following all these pictures, you see what is involved in dentistry, and it is. First of all, it is definitely not for the faint or the weak of heart. It is, some of these pictures of what these dentists and these hygienists have to see and do is just unbelievable. But you get to see how much flying debris there actually can be from the mouth. And, you're laying down, you're in the supine position, and, you're vulnerable. And so it's like, well, if the dentist has to wear eye protection and everyone else in the room does, why not me, So that's kind of one of the biggest reasons why I was like, I need to say something. I need to make sure that, people find out that this happened, and that, it's not about naming names. It's not about, saying this was never done maliciously, it's not about any of that. It's the fact that infection control wasn't top priority, so, and again, coming from a patient's perspective, we walk into the dentist, we have no idea. We're just like, oh, okay, hey, yeah, this hurts, blah, 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 whatever. We don't really know what to expect, and someone that's not like me, or that hasn't heard everything that I say all the time about eye protection, they're not going to know necessarily what exactly could happen. So that's one of the reasons why I was just like, it's so important that I say something, and it's so important that dentists, like yourself, try to do something about it and say this really should be mandatory. But now that you have your own practice, she can make the rules. She can say, we're not going to see you unless you put on eye protection, because it does work both ways, okay? Because as much as we, as much as me and my visionaries and everybody out there, as much as they're saying, like, you have, as a patient, you have to wear eye protection, and as much as the dentists are saying you have to wear eye protection too, a lot of patients don't want to wear it. I mean, for what reason? I don't know. Show them my picture. But a lot of patients, don't always want to wear eye protection too. But I guarantee you that it's sterilized, it's clean. What they're giving you is for your safety. So don't fight them. Just put it on and try and take your picture and send your picture. Remember that dear Captain?
Oh my gosh! I would suggest take a picture of your before and after your procedure. I always show the patients the glasses. I always turn it around after I take it off their face, and I say, "Aren't you glad you were wearing glasses?"
Yes.
Because if you look, there's the debris.
That is a great point. That is a great point.
You really want that in your eye, and from what I told you, closing your eyes doesn't work.
No. And I actually had somebody. I don't want to really call anybody out, but I post a lot of things.
Oh no, I think you're going to say what I think you're going to say.
And one of the recent articles I just posted, this lady was like, "Why didn't you just keep your eyes closed?" I was like, "Really? Ew." First of all, it wasn't even that simple, and if I would have thought of it at the time, like, I would have. But I don't know. Whatever. Go troll someone else's page. But seriously, that's the thing. Like, even with your eyes being closed or anything, and like you said, a person actually blinked this into their eye.
Blinked it into their eye.
It's, you open your eye for 1 second, you close it again, you can now blink debris into your eye, and now it's there, even if, by no fault of the dentist, it lands on your face. But that's why we have the eye protection on.
What if it's an old filling? What if it's metal?
What
if it's metal from a crown?
That is one of the biggest things too, because people say often, well, I was just going for a cleaning.
You know how sharp those instruments are?
Yes, I do. I do. and that is like, and I say to them, especially a cleaning, like, especially I think for any procedure, I always say, every patient, every time, every procedure, you need eye protection on. You don't have to walk through the front door with it on. Don't be silly. But when you're in the chair, you have to have the eye protection on. But during a cleaning, like you said with the debris on the glasses, next time you go, check it out. Put your glasses on nice and clean before you go in for a cleaning. And when you leave, take a look at the front of those glasses, and you'll be able to see how much stuff actually was flying all around. Even if it's just spit or water. But that also leads me to the next thing, which is, one of the biggest transmission or eye injuries that happen from the dentist is transmission of STDs. Not your fault. But totally gross, right? Like, yeah.
I'm surprised that's it.
So it's an STD from someone else's mouth that is now in your eye. That's like really gross, right? Yeah. So this has happened often. This is actually one of the most documented that I can find of, as far as injuries go, for dentists or for patients at the dentist. It's STD transmission, which is like really gross. So yeah, but I want you to turn those glasses around next time when you're done and see like how much debris is actually on them, because you're going to get a really good idea. And like I said, it's not just sharp objects either. It's spit as well. So there's a lot of stuff in there that your eye does not have what it needs to fight the Streptococcus mitis bacteria. Your eye does not have what it needs to fight that bacteria. So you just want to make sure that it is nice and safe all the time. Right?
Yeah. No, I have to tell you that one of my biggest complaints as a dentist with regards to cleaning up or cutting off crowns and fillings is, if it's in the right place in the mouth, I actually feel all that metal, all the metal shavings coming at my face. And sometimes it stings, and I just think, oh, thank goodness, I have the mask on and I have the eye protection on, because I get pelted. And sometimes if it's angled just the right way, patients, you just never know.
It's scary, but truth at the same time.
Yeah, and that's the reason why we have to wear eye protection. But what
goes up must come down.
Yeah.
If it's flying up at you, it's coming down on us. So that's exactly, and it's such an important part is to realize that even the clinicians that are in there, everybody has to really worry about infection control. And so that's why, they are suited up with the masks and the eye shields and the eye protection and everything like that, because everybody in that room,
it's
like
protected
you said,
from you.
Exactly.
But you're not protected.
Exactly. That is so true. Everyone's protected from you except yourself. So, this doesn't really make too much sense, does it? So, why do you feel that it's so important to have infection control guidelines and to have dentists do continuing education with not only just themselves but with their staff for infection control? Why is infection control so important in this setting?
Well, as you were talking about, just protecting your eyes is one of the best ways to catch something, is things getting into your eyes, especially if it's contaminated with blood, and we work with blood often. Needle sticks is also another one, so there's also guidelines for that. But with regards to my staff is my family. I spend more time with them than I do my actual family. And I can tell you that, it's my number one priority. They depend on me to make sure that I give them a safe work environment so that we can do what we have to do. And unfortunately, when things are really busy and, you're trying to get patients in and out, people are waiting, if there's a shortcut to be taken, unfortunately, it's protection. And thankfully, in this environment, we're big on protecting ourselves and protecting the patients, because honestly, you only get one body, and hepatitis and HIV. Not to be crude or anything, but anybody got time for that?
No, at all. I know I'm done with my time for anything like that. But for anyone else, though, that's a good point. Nobody, you really don't have time for that.
I would much rather take the time, stop, okay, I forgot my glasses, hold on, let me make sure everybody's protected, let me make sure you're wearing your safety glasses. Instead of saying, oh, okay, you know what, let's just go ahead and do this real quick, everything will be fine. It's just
real
so
quick
much easier.
Scares me.
Or else you'll pay, you can be paying for something, for a mistake for the rest of your life.
That's true.
And
I know. And I'm so glad there's people like you that exist that realize that this is a problem. Why isn't it the law? And there's just so many questions to be asked about it. And I'm so glad that you are here and you're kind of taking a stand and saying, dentists have to hop on board. And what I'm doing is I'm going to make it easier for everybody to get the information for these dentists. So, there's going to be lists of dentists that I know that, always use eye protection in their office, and we're going to have a special spot for them on our website because people ask me all the time, I need a good dentist. I need one, that when I go in, I know that they have eye protection for me, not just a pair of sunglasses. Even though I always say something is better than nothing, but I'd rather have you use the ANSI certified glasses, the professional ones where you can't get any spit in your eye or anything like that. I would rather have you use them, and I want you to know what dentists you can go to that provide them. So, and like I said, that's why we're here with Dr. Bev today. I was just looking at what we'll never be able to keep up with all the stuff. So it's just
and I am going to say I'm not a unicorn by far. There's so many dentists out there already know this, either because they've had an experience like mine, or it's just because it's just the right thing to do. It's just the right thing to do.
It is, and it's about time to do it, right? And it amazes me that it actually took this long. And I was actually saying earlier to Dr. Bev that it's a lot of the dentists who have been in practice for a really long time that don't want to change the way that they've been doing things. And so we need this new forefront of dentists and everybody to stand up and say, this is how it has to be, even though it hasn't been in the past. This is how it has to be now.
Like the gloves that Sue was talking about.
Yeah. So the funny story, okay, so what is her name? Sue?
Sue, yeah.
Okay, so Sue works in the office here, and there's a bunch of great girls that work in the office here. And so she was stating that when she first went to, what is she, an RDH?
Yeah.
Okay, so she's a registered dental hygienist. And when she went to school back in, did she say 83?
No, 84.
84.
No, she's 21.
91.
No, she's 21.
She's still in school. No. So the point is, Sue is fabulous and doesn't look a day over 21. But when Sue was in school, it was not a requirement back then. Like, she didn't even have to use gloves. Like, think about that now. Like, now you're just like, you would never think about not wearing them, right?
Ew. Like, we love you guys, but ew.
Right. Well, I know you have a dirty job. Like, what you do, like, I'm telling you again, if you ever want a really good idea about, like, what is involved in dentistry, you're going to go to Instagram and you're going to look at what these dentists, like, with the videos that they put up and the pictures that they take, and I'm telling you, you're going to get a whole nother feel for what dentistry really truly is. It's not just people with fantastic smiles and they, you know, I mean, they get down and
that takes work.
It really does. Like, I'm talking, you know, gums are I just, you know, and again, it really has to be something that you gotta love and be into, because it's amazing. And that's the thing that I've found with the dental industry is that, like, the people that are into it are, like, so into it. They're just like, oh my god, dentistry, and I'm like, wait, what? I'm like the dog catching its tail, like trying to catch up with everything and, like, all these companies and new products and dentists and everything like that. And again, I just hopped into it, so it's not like something that I had chosen to actually do. So it's again, I'm chasing my tail, but it's a huge industry, huge, and they absolutely love their industry. They love what they do. I haven't met anybody that doesn't absolutely like, that is in dentistry, that isn't like dentistry. I'm going to a conference, I'm going to a class, I'm going to a meeting. It's a constant, and it's just the way that it is, but it's one of those always evolving types of professions. So it's, you know, always being able to upgrade yourself, continuing education, stuff like that. So they want to stay up to date with everything. So
it's basically really easy to alienate yourself.
Oh, I thought you were going to say really easy. I was like, nothing seems really easy.
No, nothing like No, but it's so easy to alienate yourself. Like, you know, especially like sole proprietors, people who own their own practices. If you're not in a group setting, it's so easy to get stuck in your ways. And I think that's pretty much what's happening with a lot of dentists out there. Is, you know, they go into work, they do what they do, and, you know, nobody really says, no, you're doing that wrong, or nobody questions.
Right.
So if they don't have it in them to go take these continuing education classes or attend study clubs, you know, you're pretty much going to do the same thing that you've been doing for 30 years. Right. Well, right, exactly. You're not going to change. You're not going to improve. So much has happened in 30 years, and we've learned so much more about dentistry, and I even see so many, still all the time, new inventions and new gadgets and new, you know, the silly new, like, did you see the new one where it's like snap-on dentures or something? Oh! It's so silly. It is. Wait,
so,
which one? The one from Amazon?
Like, yes. You literally like pick like a small, medium, and large, and like you just snap it on, and you walk out, and these people are like their teeth. I'm just like, no, don't do that. Go to a real dentist. Don't just order snap-on teeth from Amazon, people. This is your warning right here. Okay. Do not get the snap-on teeth. It's just no. Halloween, maybe. That's it. Okay. But yeah, Amazon's good for a lot of things. Not snap-on teeth. I wouldn't say
not dentistry.
Snap-on teeth. So funny. So, what made you choose this profession that you love so
Oh my
much?
gosh, I was hoping she wouldn't ask me this.
That I would or wouldn't?
Wouldn't?
I take it back.
No,
I really want to know.
I'll answer it. Oh, okay.
What? I mean, what made you, what made you decide, like, this is what I want to do?
Okay, so I wasn't always dental crazy.
Okay.
I chose to go into dentistry when I was in college, and maybe I was trying to impress my boyfriend.
Ah!
Maybe he married me because I worked.
No way.
So I wish I could tell you that I've always wanted to be a dentist.
But that's the truth. I
That's not
appreciate the truth.
truth.
No, seriously. Sometimes you know how many people change majors in college or go in without even knowing one. But here's what I always think. I worked in college admissions for like 11 years. That's what I did.
Oh
so
my
like,
gosh, I didn't know that. That's
yeah. So like, I would interview students coming right out of high school that were going into college, and I would have a 17-year-old sitting in front of me with their parents who was more excited about them going to school
Their parents
than
know
they
exactly what their kid is going to do, right?
Oh. And we would have to try to tell them that they have to take these classes, and I don't want to major, I don't want to take these classes. And at the same time, I'm like, the kid's 17. Like, it's hard to make a decision at 17 to be like, I want to be this for the rest of my life. Sometimes you need a push. Sometimes something has to send you in that direction,
Absolutely.
So like, that boy that you wanted to impress, is he in medicine?
Yes.
Okay. So it kind of was like a common bond then. Like, you were you guys could talk like meds and stuff.
Well, yeah, he was my boyfriend at the time. He's my husband now. But
Okay.
he was the one who decided. He just said, I think you make a good dentist. And I remembered looking at him and I went, what?
Really?
Why would you say that? But it just happens to be one of those times in my life, and I'm going to admit this, and I can't believe this is going to be immortalized on the internet, but the one time that my husband is right.
Aww.
And he knows me better than myself because he's amazing.
That's what happens.
And
Mine too. Mine too.
And now I'm doing something I really love. So.
That's awesome. That's a good story.
But you can't get into dental school with a story like that.
No, but you can get into people's hearts, and that's what we want to do. No, that's an awesome story. I think that's really cool. And how cool that he's like your husband now, and you guys have really cute kids and stuff.
Thank you.
It is, and her kids are adorable. So I already asked you about Jenn's vision and the campaign and how you learned about it. And just in case you didn't hear, and you're jumping on now, because I see that people are joining our talk and stuff, this is Dr. Bev. And in case you missed anything, we will replay this video shortly so you guys can go back and kind of listen to everything that we had to say. But yeah, hi guys, I see everybody saying hi and giving us love and thumbs up, and it was awesome. Yes, so really, one of the most important questions is, why do you think that it's so important for dentists to kind of band together and say that this has to be best practices across the board?
Okay, so just speaking from the heart.
Yes, please. I like
I don't
that.
know how to
Look,
do
so
it
you're
any
getting
other
hearts.
way.
When you speak from the heart, you get hearts.
Aw. Thanks, guys. In my opinion, and this is just speaking from my personal experience and just my practice and my patients, there is the doctor, or should I say the dentist-patient relationship is a really, really special one. And the reason why I say that is because from the patient's perspective, I understand that in order for you to go to the dentist, you actually have to not only take the time, but you also have to put aside all of your fears that has been put there from your childhood.
It's hard for me.
You physically have to take all of that when you walk in through the door and say, okay, I'm going to sit down in the chair and I'm going to open my mouth for this complete stranger. And with that, you trust us to basically give you the right environment. We have to give you the right environment to be able to set aside those fears and be vulnerable. Because honestly, when you're in the chair, you're extremely vulnerable. And I just can't imagine that if there is something that I can do to help my patient be safe, because let's face it, while you're in that chair, your pain becomes my pain. Like that pain is like, or whatever your issue is, that's my issue to heal at that moment in time. And I have to make sure that I pretty much, keep you safe, because you trust me to keep you safe while you're in the chair. And that's what dentistry is all about. It's all about making sure that we improve your quality of life, that when you walk in through the door, you're in a much better position walking out than you were walking in. And without that, without the patients, there's nothing. There's no dentistry, there's no Love Your Smile, there's no, I might as well just stay home and read books. Because that's what it's all about. And it's pretty much the same goes for your surgeons, for anybody that you trust to touch your body and treat you. Yeah, it's all about the trust. And
it is.
That's why it's very important that it's so simple when you think about it. Go to Home Depot, get these glasses.
Walmart, Target. Like if you go to, if you are wondering where you can get like just glasses, and this way you can show up to your next dental visit. I mean, you can always contact me, and I will lead you in the right direction. But you can always go to, like she said, Home Depot, Lowe's, Target, Walmart, and go in like the lawn service section. And honestly, that's where you find ANSI certified glasses, and they have them there, and they probably even have quite an array to choose from, like different brands and stuff like that. But
I'm pretty sure I bought like 10 for $12.
That's what I mean. Like they're so cheap and inexpensive, and
Amazon
especially
has them for $2.
Yes, and especially if you're like one of those people that skeeve, wearing someone else's glasses. I mean, of all things, that shouldn't be what you skeeve.
We wipe ours down with Cavicide. Actually, they say just wipe them down with alcohol. We go even further than that because it's really important to us that they're clean. So we actually wipe them down with the same stuff that we wipe everything else down with, which is overkill, but
No.
You do what you have to do. And if the glasses break down because the disinfectant is too strong, you just buy another $2 set of glasses.
Amen. I love what you said. I mean, seriously, it really is such a low cost for these glasses, and it is so important that you do wear them and that the dentist do provide them, and that like I said, you have the safest dental visit that you possibly can. And so one of the reasons why I really wanted to do this with Dr. Bev is because I've been getting so many messages since our Fox 29 interview kind of went. It's going crazy on the internet. And so like I'm getting so many messages of people and why they're scared, and now they don't want to go to the dentist, and their dentist doesn't offer eye protection. So I really hope that this interview was able to kind of put you at relax you a little bit and kind of let you know dentists do care. There's nothing to be afraid of. What happened to me was that an accident. It was preventable though. So that's what we're here to do, is to make sure that the measures you have to take, just to make sure that it doesn't happen again. And I'm hoping that you go to a dentist that will provide you with the eye protection,
or can learn from you.
Yes, absolutely. Making sure that they know our story, that they know what happened to me. They know, what Jenn's vision is and what we do and why I won't get off this eye protection kick. I mean, obviously, I have a really good reason, but, it's so important that this doesn't happen again to me. And that's why I started all of this whole big thing. And now we reach 45 countries this year, which is just amazing. So I know we're just eye protection for all here. Eye protection. I wish I could seriously make it rain. Eye protection for everybody. Eye protection, and you get a pair, and you get a pair. I'm gonna be like Oprah, giving cars away, and you get a pair, and you get a pair. Eye protection for everybody.
Can we hashtag that?
Hashtag eye protection for everybody. So yes, until the day that I can make it rain eye protection, we're gonna sit here.
Or maybe we won't have to, because there'll be eye protection everywhere.
Yay! That's what I want. I want that. I want it everywhere. I want it to be, to where, I feel the air just kicked on. I want it to be to where, you don't even have to ask the dentist. Like, you walk in and the dentist is like, I'm not going to treat you unless you have eye protection on. That's what I want. I actually just recently saw a picture. Someone had shared it to me, and I did share it on the Jenn's Vision page so you can see it. It was a nice big picture that the dentist had wrote and put in the office and said, no patients are seen without eye protection. Ooh. And that is awesome, and that is what I want to see. People are just coming and going and talking, and we're just seeing stuff fly by our screen, and we're just here having a nice little conversation. But I really hope that you guys had an awesome work week, and that this was just kind of like a fun little Friday night thing for you. Go do your Friday night thing, whatever that may be. Although for us, working moms and stuff like that, it's kind of hard to stay up late nowadays.
We're going out after.
We are. We definitely are.
Mommy style.
Yeah. We definitely need to talk more, for sure. But yeah, so I really hope that you guys enjoyed our Facebook Live, and I'm gonna have Dr. Bev all of her information up on our site and up on our website. In case you're looking to come here, in case you're looking to contact her, she's very, very social media friendly, so she is really good at getting back to everybody. So if you have any questions, please make sure you ask them in the comments section, and she's going to try and get back to any questions that you might have. But I just want to thank you guys for joining us on this Friday night. And for Dr. Bev, literally, she was finishing her last patient when we were here today. And that's why we came on a couple minutes late, but it is what it is. And she wasn't compromising the treatment that she was giving. So we sat here and had a couple extra minutes, and it tells you a lot about her. So it's really good. But yeah, so we'll have all her information up, and I really hope you guys have a fantastic weekend.
Have a great weekend, guys.
And we will be back next week with some new, more exciting information. Happy Friday.
Happy Friday, guys.
Bye.
Bye.